Hi, my name's Dr. Jo Hope and I'm talking to you today about our paper, I'll put up with things for a long time before I need to call anybody, Face Work, the Total Institution and the Perpetuation of Care Inequalities. This was part of a wider project looking at improving fundamental care, so it's more person-centred, which was funded by the NIHR Clark Wessex. So we know that care can be missed in hospitals, and we know that people with more complex care needs experience care inequalities. And there's been some discussion about whether patients might be in a good position to highlight missed care. And our existing concepts of shared decision making, like we have in the NHS, they kind of assume an empowered health professional and equally empowered patients. But we know this is at odds with a research literature that talks about the constraints nurses feel to provide truly person-centred care, and patients not wanting to be seen as difficult. And we also noted that the patient's role in nurse-patient interactions is quite under-theorised. We interviewed patients who are taking part in our study, and we also spoke to people through focus groups. And we asked them about missed care and person-centred care and how they managed this and what their experiences of care were overall. And we found that patients talked about wanting to be a good patient and very much scrutinising the performance of nurses. And they wanted to know that nurses were caring and available, which we called engaged, before they asked for support. Now, we found that patients also spoke about nurses who they thought were caring but not available, and that they found it difficult to ask for support from those nurses. And we found in those situations what patients were talking about really reminded us of Goffman's ideas around the total institution. In this case, it was mainly around batch living, but also Goffman's work around face and the maintenance of face was really important here. We also had patients tell us about some very poor experiences of care they'd had where they felt that nurses were neither caring nor available, and we termed that disengaged. And this was where we saw some very strong aspects of the total institution with dehumanisation, with feelings of with information being withheld, and with this real kind of total institution that was focusing on the routine over the people. We found that people who had greater care needs, so people who needed more physical care, but also people who had a diagnosis of dementia, or people who had communication problems, were much more disadvantaged with care that was seen as distracted or dismissive. So in terms of the implications, we can see that Goffman's work is still relevant today in the modern hospitals, and that patients are unlikely to ask for help unless they see nurses as both caring and available. And that can be very difficult when nurses have a high workload.